A very big hello to all my dear students. So, how was the exam? Here I am. We are going to discuss the recall questions of ophthalmology. I don't think it was very difficult. If you had studied well, ophthalmology was good, right? The questions would, I would say, moderate, if not very easy. Right? I think if you had studied nicely, you would have answered, attended the lectures seriously. I think we covered almost everything, right? So almost 100% was covered. Let's discuss one by one and see. I think you all must be already into this and discussion, but anyway, let's start. So, what type of cataract is associated with blunt trauma? Everybody knows, you see the figure, what can you see in the slide is your rosette shaped cataract, isn't it? Yes, good afternoon. Good afternoon, all of you. Very good. Yeah, Opthal was scoring. I think maximum one-liners were there, right? So if you had listened to my cues and double cues, then I think you must have enjoyed the paper very well. That's what I was also looking at the questions. Though the number of questions were more this time, I think so, right? The students are saying that the number of questions on ophthalmology was more. Anyway, let's quickly discuss it. What type of cataract is associated with blunt trauma? I think we all know this answer is rosette shaped cataract, isn't it? Everything has been discussed in the lecture if you are attending the lectures and seeing the videos. So this is the rosette shaped cataract. What were the other options? So we know what is snowstorm, which is seen in diabetes. We know about Christmas tree cataract and so on. Right? So these are very simple questions. We come to the next question. So what could be the cause of an acute sudden painful diminution of vision with vertically oval pupil? Was vertically oval pupil really given in the question? Then though I don't think there should have been any second thought. Very quickly your answer becomes angle closure glaucoma. Isn't it? So all of you? Any problem with this answer? If it is an acute, painful diminution of vision, so you have learned with me in angle closure how, especially in acute primary angle closure stage, which we also call acute congestive glaucoma, where all 360-degree angle is closed, pressure goes very high, up to 40 to 60 millimeters of mercury, and there is corneal edema, which is going to immediately cause very diminution of the vision at that time, right? And typically the pupil in that case is vertically oval mid dilated. I think nobody is in mood to discuss in detail about every question. We are sitting here for the recall. So I'm not going to make the diagrams and do this. You have revised it and you must have answered correctly, right? If anybody wants me to discuss, you can tell me. I'm open to that as well. Yes. Okay. Is there anything confusing among all these options? CSR, of course, not confusing at all. Cataract, not confusing at all. Yeah, optic neuritis can also, but again, it's such a typical finding. The answer has to be acute congestive glaucoma. Okay? Okay. So again, this has all been discussed in your lectures. We come to the next one line again. Very simple. Oil droplet cataract is seen in. We all know galactosemia. We have learned that this is due to the deficiency of enzyme GPUT, that is galactose phosphouridyl transferase. And if there is a deficiency of galactokinase, then we have learned together in galactokinase, then the cataract would be lamellar cataract, isn't it? So therefore, answer here is galactosemia, right? Yeah, so it's again A. Again, this is all discussed in your lecture, right? What type of local anesthesia we give in the cataract surgery? So here our best option, we can give bupivacaine along with the lignocaine because bupivacaine is going to help to sustain for a longer time. The effect is sustained for a longer time. But yes, if I have to choose among all, I have to choose lignocaine or lidocaine. Right? So again, the answer is A. Very nice. Yes. So again, here the answer will be. So this also seems to be a very simple question. And again, in our lectures, we have also revised what is perivulvar anesthesia, what is retrovulvar anesthesia, and how we can give the combination of all three. We also give hyaluronidase too, so that it spreads and the effect is spreading faster. Isn't it? That's all we have learned. And what do you give for topical? For topical anesthesia, I have learned with me, it is Paraking, right? We come to the next. Which question was not there, Umar? So what was the question? So if you all feel that the question was different, either you can just put it in the chat here, or you can DM me. We come to the next one. Curtain falling sign. Again, it was so simple. The answer would be which? Can you tell me which retinal detachment? Okay, oil droplet cataract wasn't there. Okay, I have been given these recall questions so I'm discussing. You all can add to it, please. Okay. Okay, Chota doctor is saying everything was there. Yeah. Anyway, Dr. Light, yes, it is retinal detachment. Which type of retinal detachment? How will you enlighten me? Which type of retinal detachment hoga? Curtain falling in front of the eye. It has to be rhegmatogenous retinal detachment. No? So it has to be rhegmatogenous retinal detachment. We have studied this also very, very nicely and in detail. This is what means like curtain falling in front of the eye, right? So this is a typical feature of rhegmatogenous retinal detachment. Everything has been covered. Yes, Ram Kumar, that's what. Next, we come to cherry red spot is seen in. Again, a very, very simple question. The only thing confusion if Tay-Sachs and Gauchers both were given. I have told you that in both you can get it. So it's a debatable thing. Somewhere it is written Gauchers we don't get, but it is not true. But yes, if both the option is given, definitely our first answer has to be Tay-Sachs disease. There is no confusion again in this, right? So, okay, okay. That's okay. Yes. So again, this was your chariot. Okay, so they had asked you something like this. Good. So answer would be Tay-Sachs. We come to the next. Which nerve innervates the lateral rectus? So everybody remembers LR6, SO4. So answer is it is the sixth nerve. So again, this has all been discussed. What is LR palsy? What will be the position of the eye and all that? That is the sixth nerve is supplying the lateral rectus, isn't it? So we have done this also in detail. Next question, which nerve defect causes leg of thalmos? So leg of thalmos, so which is the muscle which is responsible for closing your eyes? It is orbicularis oculi, okay? If it is orbicularis oculi, tell me then it is supplied by seventh nerve. It was absolutely so simple, right? So here the answer is seventh nerve. So any facial nerve palsy is going to lead to, any facial nerve palsy can lead to inability to close the eye fully, that is leg of thalmos. And let me remind you that this is the reason for exposure keratitis. Exposure keratitis. Yes, so it's a seventh nerve, again discussed nicely in the class. Okay, how does the WHO define your blindness? We all know it is BCVA, best corrected visual acuity in the better eye of less than say 3 by 16 or visual field of less than 10 degree in better eye. Right? यही पढ़ा था ना? And from 2017, NPCB is also defining blindness. This only the difference is instead of best corrected visual acuity, it is best available visual acuity, isn't it? So this all is also discussed nicely about the definition of blindness in your class. Right? Okay, guys. So that was the question. We come to the next question which I've got is which drug, which is an ATT drug, can cause sudden vision loss or diminished vision? So we have learned about nutritional optic neuropathy or toxic amblyopia or toxic neuropathy, correct? So what were the drugs included in that? Tobacco, ethambutol, chloroquine, ethyl alcohol, methyl alcohol. Remember? So, and one more thing, do you know even isoniazid can also affect the nerve. But again, if ethambutol is given, I should mark it. Okay, so this has also been nicely covered here. What is toxic amblyopia and how this can ethambutol and as I named tobacco and all these different drugs can cause optic nerve disease, right? And you all remember now when the optic nerve disease is affected, what did I teach you? What are the five fingers? Decreased visual acuity, visual field defect, decreased color, decreased brightness, and afferent pupillary defect, right? Don't forget those five fingers. You can apply it everywhere in your neuro-ophthalmology. Yeah. Yeah. So, okay. So again, optic neuritis and an optic nerve problem. So we all know that there will be your red-green color vision loss can occur, isn't it? Put a doctor. That's a very cute name, Chota Doctor. I like the name. Okay. Then we talk about, अब तुम बहुत जल्दी बहुत बड़े डॉक्टर बन जाओ, बहुत सारा आशीर्वाद, फिर तुम लिखना बड़े डॉक्टर. ठीक है. Okay, so vitamin A deficiency is associated with, now this is the simplest question anybody could get. We all know the answer is Bitot spot, right? So Bitot spot will be the answer. What should I explain you this? You all know what is pingicula, what is pterygium. Stalker's line is iron deposition in front of the pterygium. We have learned much more than what has been asked. So you all know this is all covered again in your lecture. What is bit, and where is Bitot spot more common? It is temporal, right? The answer, it is temporal. Kisme with correction, without correction is the option. Okay, so with wait a minute. Whenever we are talking about loss of vision, even with the specs correction, you are not going to get that vision of 6/6. That is what amblyopia actually means, isn't it? Okay, we then talk about the next one. What could cause, yeah, after looking at the question, I knew today it is going to be very quick. So what could cause sudden loss of vision without fundal glow, no history of trauma? So even if there is no history of trauma, there are so many other causes of vitreous hemorrhage. We don't have to get confused. Our tip is without fundal glow. So whether it is optic atrophy, acute congestive, acute anti-uveitis, whatever options I've got, maybe there are some different options, but fundal glow will be present. So here the answer becomes vitreous hemorrhage. Okay, Ramkumar, if it was according to NPCB, we will answer best available correction. के बाद भी the vision is less than 3/60. But if it was WHO, then the term has to be best corrected visual acuity. Corrected means in spite of putting the specs and correcting, the vision is not improving. And that too in the better eye बोलना जरूरी है. ठीक है? Okay, so this little bit of nitty-gritty, you have to know this. The difference between the definitions between WHO and NPCB. Okay. Yes, it is no fundal glow, which is very important. That's why we answer. And this has all been again discussed in your class. We have talked about ultrasonographic USGB scan findings of a vitreous hemorrhage and what is vitreous. The next question that you all have given is, what diagnosis is suggested by having different refractive errors? That is +5 in one eye and +1 diopter in the other eye. Refractive powers, not errors, refractive powers. लिखा एक ही बात है. So naturally, it has been corrected, and this is the correction given in the two eyes. Now, it is asking what diagnosis is suggested by having different refractive powers, +D in one eye and +1 in the other. Why? I don't know. Unless and until the vision is mentioned, how can we comment on amblyopia? हो सकता है with this and with this, if the patient is reading 6/6, he is not amblyopic. So, of course, the difference is more than 2.5 diopters in both the eyes. Therefore, this is definitely an anisometropia. But is this actually an amblyopia or not? This can only be commented when the correction is told. Okay, in this eye, with this correction, the vision was this. 6/6 or 6/12. The best corrected vision in the other eye was this. Then only I can say whether it is amblyopic or not amblyopic. Okay. So, avoid these the options. Vision was mentioned. Okay. If vision was mentioned and it was not corrected, then our answer is obviously then there is no complication. It's an anisometropic amblyopia. Okay. Vision should be mentioned. That's what I wanted to know. Okay. Vision was mentioned. Right. अब ठीक है. फिर तो I think it's okay. हाँ. So Sandhya, no other visual abnormality जो present. जो आप बोल रहे हो, so naturally that's how you define amblyopia as partial loss of vision with no organic cause. So diagnosis goes more towards this only, that is amblyopia, है ना? Yeah, and generally amblyopia is diagnosed in the child only. Generally our patients are, of course, if you don't correct it, any adult will also have an amblyopia. Generally we are diagnosing in a childhood, so maybe the history is child. But one of you are also saying that this was not given in the option. That anisometropic amblyopia was not in the option. So maybe if this was not in the option, vision was given, it was not corrected, and if amblyopia was in the option, If vision was mentioned, I'm again repeating, then we can also mark amblyopia. Umar? So amblyopia, that's fine. You can say it. See, okay, so vision is, sorry, 6 by 18 in right and left eye में 6 by 6 है. So, again the power in one eye, that means right eye must be plus 5D, isn't it? Because more refractive error, not corrected earlier, has made the eye amblyopic. So then you can simply answer amblyopia also, that's even correct, if the vision is mentioned. ठीक है? Yeah. हाँ, तो चाइल्ड में ही बताया ना अभी आपको सच, चाइल्ड हिस्ट्री ऑफ अ चाइल्ड इज more authentic towards, okay, we are diagnosing this, there is no problem. Okay, so again the different type of amblyopia and everything, just to give you here this idea that everything is again discussed in the class. There was nothing which came out of the course. Okay, we have discussed every single thing. Okay, so these were the questions which I have got, and anything else that you want to add? I just came to know that there was some question on Sturm's conoid. I hope you know, I don't know, I didn't get the question though. So if there was a question on Sturm's conoid, you know what is a Sturm's conoid, and we are looking at the refraction of the rays at an astigmatic surface. So in that case, they show you it very nicely that, okay, vertical axis, the rays are focusing at one point, horizontal the other point, and where can you see the best? At the circle of least diffusion. इससे ज़्यादा at your level they will never ask. I don't know. Can you all share something about any other question? Pihu, if the vision was mentioned, then we have to answer amblyopia. Okay, we just can't answer refractive error because vision was mentioned, right? So they are trying to ask you about whether you understand this. So then we should not answer only refractive error. Okay. Okay, so beaten bronze appearance was asked. So how it is in which condition? Tell me. Beaten bronze appearance. Stargardt's disease. Yes, Stargardt's disease. Yeah. So beaten bronze ka to the answer is, Chota doctor, the answer is Stargardt's disease. एक बार just revise it again. I have covered in my lecture. You are telling the option of which question, Atif? Burn, contusion, abrasion for which? Okay, Rohit, myopia with a concave correction, huh? By concave correction of the lens. Okay, what was the question exactly for myopia? You have to just see that the image is focused on the retina. If it is exactly on the retina, then this is a corrected image, right? Okay, if they ask you beaten bronze appearance affects which layer? Go back to your basics. Stargardt's disease is dystrophy of which layer? Tell me. Best disease, Stargardt's disease, these are dystrophy of retinal pigment epithelium of the retina. Retinitis pigmentosa is a dystrophy of rods and cones. Isliye I think, Tawfiq, if this was the question, we had to answer. Okay, Uzma, old age, mild vision diminution, something of that. So this doesn't help. I need to know the question. Otherwise, if you ask me old age, mild diminution of vision, what clicks me is presbyopia or cataract. Most common, है ना? So, but you will have to tell me about the question. Options were different. Okay, if you are going to recollect the options, you're going to DM me. I'm going to answer you. Okay? So this is so simple. In myopia, the image is focused in front of the retina before correction, on the retina after correction. Now let me tell you for hypermetropia. The image will be behind the retina before correction and on the retina after correction. Is it okay? See, if we are talking about Stargardts, we have to talk about layers of the retina. Okay. So we will again try to figure out what the question was. Okay, Atvi? Okay, Chota Doctor, you can just again DM me this question. Let me see. Because it will all depend on the options as well. Right? I'm still waiting. Anything else? I think this much discussion was absolutely clear. I don't need to revise it with you all, correct? Batao. Any other question you want to know? Okay, great. Hetvi, if you can find out the image of that retractor, you have to tell me, was it a Desmarais retractor or was it something else? Just send me the image after finding it out and we will answer you. Okay. Yeah, so chemical injury, Shruti, chemical injury to the eye, we all know. First immediate step is what? Copious irrigation with double eversion of lead. We use that Desmarais retractor for that. Okay, once you have done that, we all know we have to start with antibiotics. We have to start with steroids to curtail inflammation. What is most important for you to know? You should stop steroids after 7 days because it will inhibit your healing. And what are the other components which are very, very important in your treatment that you should not forget is ascorbate and citrate. Okay, so this is what is given for managing the chemical injuries. Just go and revise the lecture, right? Okay. Yes, copious irrigation was an option, and that is always the first step. If they ask you the first step, it's always this. Actually, this has been even an INI-CET question repeatedly in some or the other way. So please remember, it is the copious irrigation. Pehle you have to irrigate properly, right? Yeah. Okay, so all covered. Anything else you remember? I'll wait. No problem. Tell me what one more question. Tell me. So you talked about the retractor. You told about anything else you said? Just remind me. You all can actually send me the question, please. It will help to revise further and will help you for your need. Yeah, Hathway, you can just remember and let me know. Yes, one of you are asking for the thought for the day for today. So today's thought for the day is it is done and dusted, nothing to worry. Enjoy yourself a few days and just face it. Let's see. I'm very sure you all have given your 100% and you're all going to rock, right? So, yeah, Dr. Light quote for the day. So, thank you so much for asking. You know, it makes me feel so happy because this is also the favorite part of my lecture. I always like to share something. So, one line, maybe I've shared earlier, I don't remember, but let me share it again because it helps me to remind myself also that complaints nurture negativity and weakness. So let's not complain. Let's have a lot of gratitude because that is what makes us all happy. Okay, so you can note down on your copy no complaints. Complaints nurture only negativity and weakness. The moment we complain, we are the one person who will immediately get affected and we are the one who become low first. Okay, so it's something we should never, we should try to stop. It's very difficult. We are all humans, but yes, we can work upon ourselves every day. No complaints, no complaints, no complaints. Only gratitude, appreciation, gratitude, appreciation. Okay, Dr. Light. Okay, universal wire speculum was given. Sandhya is telling. Ray diagram of myopia must have been the easiest thing. I don't think there should be any problem in ray diagram of myopia. The light rays are focused in front of the retina and when it is corrected, it will be on the retina. Hetvi, किसका आप बता रहे हो? Which options of what is the question? Foreign body conjunctivitis, vernacular conjunctivitis, flectanular होगा conjunctivitis for what is the question? Vishal, complication of a penetrating injury after 2 weeks. I think I'll go for sympathetic ophthalmitis if that was the option. So as I told you, the number of questions were many. We haven't been able to recall all, but yes. Okay, Sandhya. So was it easy or not to match the image of myopia and its correction? I don't think there's anything difficult there. Multiple leash nodules. Yes. Neurofibromatosis type 1. Let's be more specific. Type 1. Okay. So flectanular conjunctivitis, Tawfiq, was not a very difficult thing. Endogenous allergy towards first Staph aureus, then tuberculosis. What was the question? Was it treatment? Then we gave steroids. Was it fascicular ulcer? Did they ask you the hypersensitivity reaction? Then it was type 4. These are the questions around this topic. Please share what they have asked. Yes. So if they gave images, yes, I understood, Sandhya. They gave images, so you could have find it out now. Where the light rays are in front of the retina, that is a myopia, isn't it? Okay. So Sandhya, if there are nodules in a lower socioeconomic and getting nodules, what comes in your mind? Nodules? Was it nodules only or follicles? Think and tell me. Okay. Nodular growth on the limbus with the ipsilateral and okay. So any nodular growth at the limbus with a low socioeconomic status, yes. And the question, and you're saying the option was uh, rectangular. It can be one of the possibilities. Yes. Then it is flectanular. It's better to go towards flectanular. The answer is flectanular. Right? Yes, Sabyasashi, we have talked about image of myopic correction. You all should know that the image light rays are falling in front of the retina. So, not a big thing. Okay, episcleritis option was there, but again, if flectanular was there, we should go for that. Okay, it will all depend. Huh? What is the presentation? Yes, Vanya, tell me, I'm still waiting. Any other question? So we have discussed all, but I'm still waiting. I'm not out. Tell me. Okay, Tawfiq, then that's done and dusted. Myopia question was straightforward. Very good. Okay, nodule was mentioned, so it's a nodule. Follicles only if there are follicles or upper palpebral conjunctiva or on the upper limbus, then we would have thought in terms of trachoma. But a nodule at the limbus, a single nodule, or this type of presentation, then we will think about flectanular. Okay. Maybe was the presentation also saying that the patient had itching? Were the symptoms mentioned or not? Acha, Hatvi, this is because we will always go towards what is most common presentation. Okay? That is why we will first prefer to answer flectanular. That's all. Hatvi, is it okay? Are you satisfied? Anybody else? Thank you. Thank you so much. Stay blessed and keep smiling. So, waiting. I am not getting any more inputs. So, thank you so much. God bless you.